To flip House Republicans and get them to vote for the revised health care plan are going on behind closed doors right now. House GOP leaders meeting with moderates. They were either no's or undecideds, trying to get them not only to flip their vote, but to do it soon. Republican Congressman Dan Donovan, and this is just moments ago, he got before the Fox cameras and said it's a hard no on the new plan. The Rules Committee is expected to meet later today on health care. All this as you've still got the threat of a government shutdown looming. Let us bring in Congressman John Garamendi of California. He is a Democrat. We're waiting on Congressman Mark Sanford, who is running in. He's the Republican from South Carolina. But I'll start with you, Representative Garamendi. Where do you stand on this? There's Mark Sanford. Good to see you. But as he's getting ready.
Both are here.
Good. We're thrilled. This is, by the way, a Fair and Balanced exclusive. Glad you're both here. We'll start with Representative Garamendi. Have any Democrats been asked to go in those closed-door meetings right now with House membership?
Well, certainly not on the Republican side I'm aware of. Generally speaking, the Democrats are 100% no. The original bill that came up and failed to even go to a vote 3 weeks ago has been made worse, in my view, and I think in the view of almost every Democrat, or in every Democrat, by the proposed amendments. So it's gone from bad to worse. And so on our team, no, if you want to do something to improve the health care insurance policies in America, we're there to talk about that, but this is going the wrong direction.
Congressman Sanford, have you seen the revised bill? And you are a member of the Freedom Caucus, the original team that dug their heels in on the first health care plan. Will you vote for it?
At this point, yes, I'm absolutely leaning in that direction. In fairness to my colleague's point, the bill in its original form was not ready for prime time. If you think about it, we had 17 days prior to when we were expected to vote that Friday. In contrast, the Affordable Care Act saw 186 days. Medicare Part D that President Bush saw 166 days. I think that this has been a rushed debate, in fairness to folks on both sides of it.
Okay, but to that point, Congressman, looking at the fact that the new one, and we've heard this, I don't know if it's true, but that it will eliminate some of the ACA, the Obamacare ideas that were extremely popular that President Trump actually said we should keep, and that would be the covering people with pre-existing conditions. Now that leaves it up to the states. That may be highly unpopular.
It might or it might not be. It depends on the state. I think that what we're looking at here is, in fairness to Democratic colleagues, in fairness to Indivisible, in fairness to folks of a lot of different stripes and shapes, baked into the cake of any reform, I think, is coverage of pre-existing conditions and staying on your parents' plan until the age of 26. But what I think is that allowing states different options in terms of what they think makes the most sense for their population is something that I think has political resonance, at least on the Republican side of the equation.
Well, my colleague, I think, really did toss the ball back to the states, and we have a pretty good indication of what the states will do. In the Affordable Care Act, there was an opportunity for the states to expand coverage through the Medicaid program, and a majority of the states, I think over 30, chose not to do that. The result is, if we're looking to the states to protect individuals, there's a track record that says that they won't. The elimination of this very fundamental prohibition against insurance discrimination based upon your health status really ought to be a national principle.
It's going to be questioned. I need to get to the tax plan that Steve Mnuchin and Gary Cohn unveiled. Congressman Sanford, I remember when you were governor of South Carolina, you were one of those governors who refused to take bailout money for your state because you were so fiscally conservative, and you said this is just to overreach and it's just too much money and we're going into a deficit. Tell me if you support this new tax plan, which of course is extraordinarily popular for many people because it will cut all of our taxes. Yes, but I was talking to some people yesterday who said, how can conservatives look anybody in the eye and say that they can vote for this when it is far from revenue neutral? There's just nothing to pay for it except the belief that the growth stimulated by it will pay for it.
Let's be clear about what we have right now. we have a one-page working sheet as to, quote, a plan. And I think what anybody on Capitol Hill would tell you is that the devil's in the details. It's true of a real estate deal in New York for, former President, for President Trump prior to him being president, and it's true here on Capitol Hill. So I think it's got to be fleshed out. I think you're right. It has incredible deficit implications, and I think that those deficit implications would consequently lead to a lot of pushback from people on both the right and the left.
Okay, before we go, and we do have to run, and I'm getting yelled at, but Representative Garamendi, Chuck Schumer, the Senate leader for the Democrats, said yesterday in a statement that this will hurt, quote, tens of millions of middle-class people. Why is that if they're cutting rates on every level, 10%, 20%, and 35%?
Well, as the governor said, it's in the details. Some of the details that we do know are that this is also coupled with the health insurance program, in which there are clear benefits taken away from the middle class because of the tax cuts that are in both of these proposals. In addition to that, you're looking at the elimination of the estate tax, which only hits the top 0.2% of Americans. So the Trumps are going to do very, very well as a result of the elimination of the estate tax. The children ought to be happy.
I know, Congressman Sanford, you want to get going on this. We must run, but I'd love to have you both back because it is a great, fair and balanced discussion. Thank you very much.
Thank you.
Thank you.
Congressman Mark Sanford and Congressman John Garamendi.